So we're going through differentiating pain and soreness, and we've already highlighted some of the key points on what each of them are, but we wanted to hit some key items of really looking at things like one of them is duration. So talk to us a little bit about duration, Mark.
Yeah, absolutely. So we went through duration a little bit with soreness, like 2 to 3 day window. Sometimes it's soreness right away. Sometimes it follows that bell curve. I think this is a good way to really differentiate if you have a pain or injury. Sometimes if it's acute, it's a pop. You'll know right away because you've got your immediate loss of function and things like that. But with this, if you're on the fence, you're not 100% sure. Sometimes, if you start getting past that 3 day, 4 day, 5 day mark and you're still having a lot of pain, a lot of soreness or a lot of issues, I think it's a pretty good situation that you're probably got an injury going on, or at least something that's happening that's telling you, okay, this is just not general soreness.
Yeah, and I would say one of the most common things I've seen where people sort of try to get through with it or deal with it, so to speak.
Yeah, exactly. Throw some dirt on it.
Right. Back pain and shoulder pain are probably the two I see most often. People try to deal with back pain. I can tell you, as someone who's, dealt with back pain before, the quicker you deal with it, the quicker you get somebody to help you with it, the better off it generally is.
Yeah,
Um,
absolutely.
Letting that normal healing process happen with the back doesn't generally work out well for people. And if you get, medical attention, whether that's going to a physical therapist or going to a physician, both could help with that.
Yeah, for sure. So I think the next one we really wanted to highlight is the location of the injury and or soreness, injury, potential injury.
Sure.
With that, so what would you say about that, Matt?
Well, I would say generally, if your joint is actually sore. So when we're talking about the joint, we're talking about shoulders, your hip, your knee, your
Hmm.
ankle, right? Not muscle bellies and not the tendon that attaches to that area. We're talking about the actual joint. If the joint's sore and really painful, that's generally a good sign of you're something a little more towards pain. Uh,
Yeah, exactly. And it may not be that acute injury with that pop or something you'll get in a muscle belly, but definitely if you're telling somebody, oh yeah, my knees are pretty sore after that exercise, that's a good sign that it's not just general soreness. That's a good sign that you've got some chronic problems that got some biomechanical or some stability issues that need to get corrected.
Right. And I think the biggest thing we find in our last key item is better or worse. Like what makes it better, what makes it worse.
Oh,
Talk
for
a
sure.
little bit about that.
Yeah, it can help in anything. And kind of when we say when in doubt, you can ice it. That's going to help with your pain management, your soreness management, things like that. I think that'll definitely make either of them better. I would say definitely light movement, and that's where you can use this as a little differentiation. Light movement with soreness is going to definitely help. It's going to make you feel better. Movement can be recovery in certain situations, especially with soreness. If you're adding in some movements and you're definitely feeling a lot more pain, or it's not getting better, or whatever it may be, that's a good sign that it's probably an injury of some sort.
And one of the biggest things would be, I noticed that if you wake up in the morning with it, you're pretty sore, but you get moving around and you're feeling a lot better. That's probably a good indication that it's more soreness as opposed
Mhm.
to pain. But pain generally is going to be there, especially when you're trying to go to sleep, and especially, daily. It doesn't really subside a whole lot.
Oh, absolutely. And that's with these differentiation keys, we're usually saying, what's your action plan when you find one of these, one or two or all three that are saying, okay, this is actually ticking off as a pain or an injury situation. Yeah, that's time to go see the doctor. That's time to go give your doctor a call and say, hey, I need to get in. I need to get this checked out.